Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the clinical COVID-19 update for Monday, June 14th. We are joined today by the Acting Chief Medical Officer of Health, Dr. Catherine Elliott. Our sign language interpretation is provided by Mary Thiessen and our French language translation by André Boursier. Following our speakers, we will go to the phone lines for questions. We will call you by name and you will each have 2 questions. Dr. Elliott.
Thank you, Pat. Good morning, everyone. I'd like to acknowledge that I'm speaking from the traditional territory of the Kwanlin First Nation and the Ton-Gwitchun Council, and I'm honored to serve all Yukoners and all First Nations people living in Yukon. Yesterday, I declared an outbreak of COVID-19 among youth and adults associated with graduation events and those who are socializing in close proximity, such as in bars and at house parties. As of today, this includes 23 cases. 18 are in Whitehorse and 4 in rural. 1 case we don't have a lot of information yet, and so that's a lot is to be determined there. We now have 21 active cases in the territory. Of the 10 new cases since Friday, 9 are linked to this outbreak. 9 are unvaccinated. As I mentioned, 1, we're still waiting for information about that person. This is an outbreak of the Gamma variant of COVID-19, which is a variant of concern that was first recognized in Japan among people traveling from Brazil. This variant is more infectious than previous strains. It may be able to infect those who previously had COVID-19. And we also know reassuringly that 2 doses of vaccine plus 14 days, 2 weeks, so those who are fully vaccinated are protected against this variant. Why did we declare an outbreak? We declare an outbreak when a group of cases occur among a common location or people who share affiliations, such as high school students, etc. In this case, some are direct contacts of each other. That's 5 of our cases. We call those secondary cases, 5 of our new cases. And some are not contacts, but are linked by events or locations. Those are our 3 primary cases among the new cases. 2 of our new cases are yet to be determined whether they're primary or secondary cases. The Porter Creek grad class is still isolating from others, as are many contacts and cases. Many people in Yukon are taking the right steps and asking for advice about how to be cautious, responsible, and prevent further spread of this variant. Many people have asked me, what can I do? What can I do now? It's more important now than ever before to get vaccinated. The vaccine protects against the variants, including the Gamma or P1 variant. This variant is highly transmissible amongst those who are not fully vaccinated and leaves less room for error in our practices of safe 6+1. If you are one of those people who are not yet fully vaccinated, the way to stop the variant from spreading is to diligently practice the safe 6+1. Keep your distance, a caribou apart, 2 huskies, 6 feet, 2 meters apart from other people who are not in your bubble. Wash your hands. Take the time to wash them carefully. Take the time to use your soap and your water and make sure that you clean any virus off your hands that may be there. If you develop symptoms, don't push through. Don't go to work. Don't go to activities. Protect the people around you by isolating from them and get yourself tested. Follow all the guidelines for COVID-19 in the territory. Many children are at camps today. Many people are going to businesses. Follow the guidelines in these places. Limit your travel to rural communities. And if you do travel to rural communities, be mindful, be courteous. Use your safe 6 manners when you're there. And wear your mask. Follow the border measures. If you're coming into the territory and you've been out of territory and you're not fully vaccinated, isolate. Keep your bubble small and familiar, and limit your visits with those who are at risk of severe disease. That includes people with chronic conditions, people who are older, seniors and elders, and people with very many different types of chronic conditions, such as asthma, those with heart disease, people who use alcohol and other substances, people who are immunosuppressed, immunocompromised, recovering from cancer, etc. I really want to point out that of the 24 confirmed cases that have been identified since June 4th, only one was fully vaccinated, and that individual had very mild illness. You may wonder how somebody who's vaccinated can get COVID-19. It does occur, and it is rare. It usually happens due to prolonged close contact, household contact, caregiving for somebody, your partner, somebody who's close, who has the disease and does give it to you. In those circumstances, the disease is usually mild, and the risk of severe illness and the risk of death are decreased. We do have cases in communities, and all of those cases have been linked to a contact who was either in Whitehorse or who cases were themselves in Whitehorse. People are asking, what's our exposure notice? Do we have any exposure notifications? And I'm really pleased to see people paying attention to this and asking this question. Here is our exposure notice. If you attended any graduation events, both either formal or informal, maybe it was a trip, a party in the evening, a dinner, organized event at the school, we are asking you to please monitor yourself for symptoms, isolate yourself if you get symptoms, and get tested. Now that we're seeing cases in communities, this includes those who are engaged in these activities, who have returned to communities or who haven't been engaging in socializing without physical distancing, whether in communities or here in Whitehorse. I'll let you know if this changes. We're not going to issue for specific locations and times at this point. I think people can work with this guidance. Individuals who are vaccinated and follow the Safe 6 and wear a mask in indoor spaces are protected. We still need more people to get vaccinated. Our rates are good, but each person is protected when those people around them are vaccinated. So the way to protect your loved ones, people you care about, people in your social bubbles, people you work with, etc., is to become vaccinated. I am concerned about the outbreak at this point, and our hope is not to have any more severe cases or any more hospitalizations. The way that we do that is we stop the spread in the ways that I've outlined today. And also, I want to emphasize that now many people are concerned. And when we're concerned, it's more important than ever to be kind, to be calm, to be respectful of people and their choices, and to help one another. Thank you for listening to me today. Thank you so much for listening to me today, and I'm happy to take questions.
Thank you, Dr. Elliott. We'll go to the phone lines now, and we'll begin with Tim, Whitehorse Star.
Good morning. Can you hear me?
Yes, we can, Tim. Go ahead.
Yes, I missed the first few minutes of your comments due to a technical difficulty, but I do have a couple of questions. Perhaps you answered them, perhaps you didn't. First one is, do you have any idea of what the source of this latest outbreak is?
At this time, we don't know the source of this outbreak. We do know how things are spreading at this moment, and they're spreading from person to person, people who are socializing in close proximity without social distancing, and people who are unvaccinated. Thanks, Tim.
Do you have another question, Tim?
The graduation celebrations that were going on, were these people observing all of the proper social spacing and wearing masks, et cetera, or do you know that?
We worked very hard with all the graduation committees to design safe protocols for the graduation cap and gown ceremonies and the dinners. And we know that some of the spread has occurred from close social contact. However, I'm not at liberty to say where exactly the contact has occurred.
Thank you. We'll move now to Marine, Laura Boreal.
Je n'ai pas de question, merci.
Merci. We'll move to Camille, Canadian Press. Camille? We'll come back. We'll move to Claudiane, Radio-Canada.
Oui, vous avez mentionné, Dr. Elliott, que vous êtes inquiète. Allô, est-ce qu'on m'entend?
We'll move with Claudiane, and then we'll go back to Camille.
Est-ce qu'on m'entend? Oh,
Go ahead,
désolée.
Claudiane.
C'est bon?
Oui, c'est bon.
Merci. Dr. Elliott, vous dites que vous êtes inquiète par rapport à cette éclosion. Pourquoi? Qu'est-ce qui vous inquiète dans cette éclosion toute particulière?
So, Dr. Elliott, you are nervous about this outbreak. Can you tell us exactly what makes you nervous about the way this outbreak is going?
Merci pour la question. Oui, j'ai dit que je suis inquiète à cause de cette éclosion. Et ce qui m'inquiète est que maintenant, tout le monde est fatigué à cause de COVID. On a fait beaucoup d'efforts pendant les 14, 16 mois qu'on a été dans cette pandémie et on est vraiment fatigué. Et ce qui m'inquiète, c'est que ça peut transmettre d'une personne à l'autre et devenir plus grand qu'il est maintenant. J'expecte qu'on va avoir encore des cas. Ça s'arrive et j'espère que c'est le minimum possible et que cette transmission est déjà faite, en effet. Et si tout le monde fait ce qu'on peut, et les Yukoners, nous savons qu'on peut le faire, ça va réduire la transmission et ça va finir. Mais si les gens ne peuvent pas faire ça pour une raison ou l'autre, ça peut bien sûr devenir plus grand qu'il est et on peut avoir des personnes qui ont des maladies qui sont sévères et même on peut avoir une personne qui va mourir. Et c'est ça qui m'inquiète à ce moment aussi. Merci.
Merci. Avez-vous une autre question, Claudiane?
Oui, donc, qu'est-ce que vous recommandez pour les élèves, les enseignants, les parents qui étaient présents dans tous ces événements de finissants? Exactement. Est-ce qu'ils doivent s'isoler? Est-ce qu'ils doivent attendre d'avoir des symptômes pour être testés? Combien de jours devraient-ils s'isoler? Juste précisément ce que vous recommandez pour ces dizaines, presque centaines de personnes qui sont concernées.
Elliott, what are your specific recommendations for everybody that was involved in these activities, the parents, the teachers, the students? What do you want them specifically to do from now on and for how long?
Merci pour la question. Ce que je recommande que les gens font qui sont dans les événements où il y avait peut-être des cas ou bien ou bien les personnes, ou bien les personnes qui sont vraiment les contacts des cas, je vais dire exactement ce que je recommande. D'abord, un contact, c'est-à-dire quelqu'un qui partage le saliva, je ne sais pas comment dire en français, c'est le même? C'est saliva, oui.
Salive.
Salive, merci. Qui partage le salive avec quelqu'un. Peut-être c'est faire le vaping ou bien c'est partager une bouteille de l'eau. Ça, c'est un contact. Une personne qui qui parle ensemble ou chante ensemble ou quelque chose comme ça pendant une quinzaine de minutes, ça c'est un contact. Si quelqu'un savait qu'il ou elle soit vraiment en contact d'un cas qui a le COVID-19, on demande ce gens-là isolé pendant 2 semaines, 14 jours complets après ce contact. Si vous êtes même pas vacciné, pas vaccination, pas immunisation, si vous avez une immunisation, c'est le même. Si vous avez 2 immunisations, eh bien, si c'est 14 jours après le dernier, pour vous, c'est de se monitorer soi-même. Ça, c'est que je demande. Si vous savez que vous étiez bien aux événements, si vous étiez bien en contact d'un contact et les gens comme ça, nous vous demandons de se monitorer. Ça veut dire que il faut se demander parfois pendant la journée comment je sens moi-même. Est-ce que j'ai les symptômes de le COVID-19? Et si vous en avez, isolez, soit bien cherchez à un test. Et pour les gens qui ont des vaccinations complètes, qui sont vraiment des contacts d'un cas, c'est le même. C'est monitorer soi-même. Aussi, pendant les 2 semaines, les 14 jours après ce contact. Si vous avez du contact qui est vraiment prolongé avec un cas et vous avez complètement été vacciné, en ce cas-là, c'est l'exception. C'est dans ces circonstances comme ça qu'on peut transmettre le COVID aux gens qui sont complètement vaccinés. Et en ce cas-là, c'est les interactions prolongées, comme habiter avec quelqu'un, ou bien avoir un partenaire, même si on habite ensemble ou pas. Ces gens-là, je vous demande d'isoler pendant 14 jours après le dernier contact.
Catherine, if you could please repeat some of that in English. We've had many requests.
Oui, bien sûr. Okay. In English, the question was, what exactly are we asking people to do? We have so many contacts at this point of our cases that we are asking for the first time publicly people to take actions that normally we prefer you talk to a public health nurse and get individualized advice. Il faut dire même en français que si les infirmières si les infirmières du maladie communicable vous disent de faire quelque chose d'autre, c'est parce qu'ils savent quelque chose au sujet de votre cas que je ne sais pas. Ça peut être un peu... il y a des nuances et il faut écouter bien aux infirmières aux maladies communicables. OK, bon, je vais le dire en anglais. In English. The first thing I want to say is that our Yukon communicable disease nurses are working extremely hard to trace and to connect with all of the contacts of cases. We have many contacts, well over 100. And so in this circumstance, for the first time, we're giving advice through the media and through letters and distribution lists that we would prefer to give one-on-one to people. And here is the advice. The first thing is, if you talk to a Yukon communicable disease control nurse or another communicable disease control nurse, they will give you the best advice for your specific case. It may be different from the general advice I'm about to give. Follow the advice that they give. If you know that you are a contact of a case, a contact means you have shared saliva in some way, maybe it's vaping, maybe it's sharing water bottles, maybe it's intimate contact with a case, you need to isolate. You may also be a contact of a case if you've spent about 15 minutes in conversation or close contact without that physical distance. Then you are also a contact. You also need to isolate. Contacts, please isolate for 14 days from the last contact with a known case or person with COVID-19. If you are a contact and you are fully vaccinated, you only need to isolate if that contact is prolonged household type contact. Somebody you live with, somebody you care for, or your partner, even if you don't live with that person. This type of prolonged contact is where we tend to see breakthrough cases or cases amongst fully vaccinated people. We are asking you also to isolate. If you are a contact of a case and you are fully vaccinated, 2 vaccines plus 2 entire weeks, we're asking you to self-monitor. Self-monitor means check in with yourself throughout the day. Ask yourself how you're doing. If you have any symptoms of COVID-19, no matter how mild, please isolate yourself from others and seek testing. If you have been at an event, a party, you've been socializing in close proximity, such as in bars or in house parties, and you are not a contact of a case as I've described, we're asking you, please self-monitor. Please check in with yourself throughout the day. If you have any symptoms, isolate and get tested. Everyone else, it's a good idea to get tested if you have symptoms. Please get tested if you have symptoms. And please be kind to each other, and let's take care of each other at this time. Thank you.
Thank you, Catherine. We'll go back to Camille, Canadian Press.
Hi, sorry about that. That was my fault. I'd like to know, you mentioned earlier you're concerned about the outbreak. What is your main concern at this point? And what has happened in the Yukon where cases were low? And can that serve as a cautionary tale for other jurisdictions that are opening up?
Thank you for your question. I've said that I'm concerned about this outbreak. What concerns me right now is that the disease is being spread, has been spread among people who are in close contact without physical distancing. Some of these people know each other. Some people could have spread to people they don't know. With this type of contact, the possibility for spread is high. My hope is that the spread has already happened and everyone has started again following the Safe 6 and keeping their distance, isolating when sick, etc., and wearing their mask. That's my hope. My concern is that with all of the fatigue that we all have with COVID-19, people are finding this hard to do. And without doing this, particularly for people who haven't had their full vaccination yet, COVID-19 will spread. COVID-19 was very good at transmitting from person to person before it evolved into the variants of concern. COVID-19 is even better now at spreading from person to person and leaves less room for error in following the Safe 6 and following the guidelines. It requires each and every one of us to do our part in order to stop the spread of COVID-19, including those people vaccinated, including those people who haven't received their full vaccine yet. It requires all of us to protect all of us. What was the second part of your question? Would you mind repeating?
I'm just wondering if, considering you guys were doing well and other jurisdictions are opening up, could what's happened there serve as some kind of a cautionary tale for other jurisdictions?
Thank you. I think one of the early lessons in this outbreak, it's something we know, but sometimes people any of us have to fall down before we learn a lesson. I think we've repeatedly said, and our guidance hasn't changed from practicing the safe 6+1 and following the border measures, et cetera. And at the same time, many people have reduced the amount that they're doing that. If you're, I think the cautionary tale is people like to talk about herd immunity. What really matters, as much as the big number in the herd, in the population that matters, the percent that is vaccinated matters, for each individual what matters is the people around you. And if you want to protect the people you love, then you then want the people around that person to be vaccinated, fully vaccinated, because that is protective. I think that the guidance and the rules are solid, and they work, and they require this ongoing diligence and persistence in practicing the safe 6+1 and following those guidelines. And I think the cautionary tale is, if we let our guard down, COVID-19 is highly transmissible and will spread.
Thank you. Do you have another question, Camille?
I do. What percentage of people 12 and over have been vaccinated there, and would Yukon consider any types of incentives to try to get that number up?
I don't have the exact proportion of people 12 and over who have been vaccinated. Our vaccine program for 12 and over started in June, and many people have received their first dose of vaccine. It also includes clinics in communities, and this week we have a clinic in Old Crow on Tuesday for young people to get vaccinated. We do not have fully vaccinated young people in the territory in any significant numbers at this point, we are seeing that young people are continuing to get vaccinated. So, for example, whether an adult or a young person, one of the people in this outbreak who has COVID-19 has had a vaccine, but it has not been 2 weeks since their vaccine. So they are not partially vaccinated at this point. However, they have had a vaccine. So we are rapidly making appointments available throughout the territory for young people, for adults. We have an active program to help people who have questions, learn about the vaccine and become confident in the safety and efficacy and effectiveness of the vaccine. And we continue to do that. We're looking at all avenues to help people become vaccinated.
Thank you, Dr. Elliott. We'll move now to Jim, Yukon News.
Yes, thank you. I was just wondering if there was anything more that we can tell the public about this gamma variant that has been causing these cases, particularly because this outbreak involves young people. I was wondering if there are major differences in the severity of illness that it has the potential to create for young people when compared to the original variant of COVID.
Thanks for the question. The gamma variant is a variant that was first identified in Japan and has caused major outbreaks in Brazil and other places. There's been outbreaks in the Lower Mainland in BC and throughout Canada. In British Columbia at this time, the gamma variant and the alpha or the UK B117 variant are fairly equivalent in the proportion of cases, and they're around 40%. So these are quite dominant variants, both of them. Because of the nature of any number of things, the research coming out of Brazil is slow, and it's not very strong. I think there was a lot of challenges caused by this variant and by other circumstances that have prevented a lot of really strong research coming out of Brazil. We are starting to see research come out of British Columbia and other places where the Gamma variant has become more prevalent. It is early days as well. So we have, for example, we have good vaccine effectiveness studies coming out of BC and other places, yet we will continue to learn about vaccine effectiveness for the Gamma and other variants. And those studies show that the vaccine is effective against the Gamma variant. In terms of severity of illness, the literature is very mixed on this. We don't have a good, strong sense of whether this causes more severe illness at this time. There is indication from Brazil that the Gamma variant can cause infection and disease in people who have previously had COVID-19 disease and cause those reinfections. And in terms of the question around young people, is this a variant like the Alpha variant that is spreads more easily among young people? At this time, we don't know. Similarly, in terms of severity, we don't have a signal of increased severity. We have some, we do know that it has coincided with severe illness in various places, but we don't have good, what we call denominator data, meaning of the total amount of cases, the percent that had severe illness, because the counting of the total amount of cases is not fantastic. So there is more to be learned here, and this is what we know at this time.
Thank you. Do you have a second question, Jim?
No, thank you very much for the answer. I don't have a follow-up.
Thank you very much. We'll move to Jackie, CBC.
Hi. I'm wondering if you could share how many of the current active cases are related to Porter Creek Secondary School. And I know you haven't found a source, but I'm wondering if this is one of those cases where it's something you're still working on, or if it's one of those situations where we will never know.
Mm-hmm. We are actively looking for a source or the origin of this outbreak. And as soon as we know anything, we will share that with you. The other part of the question was how many cases are associated with Porter Creek. It's not something that we've tallied up at this time because we don't have complete information on all of our cases. We do know that there are cases associated with Porter Creek, and there are cases in people of the same age where we don't know whether they're associated with Porter Creek Secondary School or another graduating class. We do know that the graduating classes from the high schools in Whitehorse were mixing, were socializing without physical distancing, whether in organized or unorganized events. So I'd not be surprised to see cases in other high schools in addition to Porter Creek Secondary School. It may well be that Porter Creek Secondary School was the first one diagnosed, but not the first one, the first school with people in the school who were infected. We will keep you posted as we continue to discover more about this outbreak.
Thank you. Jackie, do you have a second question?
Yeah, my question is in regards to communities. We've been seeing First Nations and communities kind of self-identify themselves as having these cases, as having active COVID cases. And I know the official policy is to not identify communities for privacy reasons, but for communities like Burwash Landing, where there are 100 residents, presumably everybody knows. I'm wondering if there are any discussions about possibly changing this policy about identifying which communities have active COVID cases.
Yeah, at this time, we are not naming specific communities. It can be quite stigmatizing, and communities can be looked down upon because they have a single case of COVID-19. That is the unfortunate truth. It also is to protect communities. Now, individuals, that is there, and communities, mayors, chiefs and council, are able to share this information, and I wouldn't be surprised if we do certainly larger places talk about. We had in the past, for example, named Dawson as a site where we'd seen cases, and this time the mayor has come out and said that there are cases in Dawson City. So we work to do what's really important to prevent the spread and reduce the spread. And I have to say that because we've identified cases in one community or another community, it doesn't mean there aren't cases in other communities. So I think sometimes it takes away from the message that we know that people have been infected who live in communities, and those people have a link to Whitehorse, and we're actively asking people in communities who have symptoms to get tested.
Thank you. We'll move to Laura Boréal.
Oui, ma première question concerne pour ceux qui doivent s'isoler, les jeunes qui doivent s'isoler à la suite des parties de fin d'année. Est-ce que ça veut dire que les parents aussi qui vivent avec leurs enfants doivent aussi s'isoler du travail?
So the question is, for the youth that have been infected or in contact, does it also mean that their parents and family also have to self-isolate if it's the case?
Il y a différentes raisons qu'on se demande aux gens de se isoler. Comment isoler à ce moment-là, c'est d'être seul dans une maison, un appartement ou avec ceux qui sont aussi des cas. Ça veut dire que la question c'était est-ce que les parents doivent isoler avec un jeune qui est un cas. C'est idéal que les cas s'isoler pas avec ce jeune-là, et ça veut dire dans un autre appartement ou comme ça. Les parents qui veulent encore travailler, c'est mieux d'être séparés de ces jeunes-là.
Avez-vous une autre question, Laurie?
Oui, ma deuxième question concerne la fin de l'école. Est-ce que vous croyez qu'il va y avoir de plus en plus d'éclosions chez les jeunes maintenant que l'école est terminée, qui peuvent peut-être avoir plus de temps pour se rassembler ensemble?
So is it your feeling that we might see more outbreaks with youth now that school is over and they have more time to get together?
It's very hard to speculate on human. Merci. C'est très difficile de spéculer comment les gens se comportent. C'est difficile avec tout le monde. C'est plus difficile, moi, je trouve, avec les jeunes. Mais bien, on ne sait pas à ce moment. Ça dépend à chacun de faire leur part et de continuer de pratiquer le 6 sauf et soin et de suivre les règlements, les recommandations. On verra dans les jours, dans les semaines qui se viennent, et nous vous dirons exactement ce qu'on sait à ce moment-là.
You started that in English. May I ask you to repeat it in English as well? Thank you.
The question was, what do I expect to see with schools out and children and youth out of school? I think it's really very difficult to speculate on human behavior and what will happen in the days to come, in the weeks to come. COVID again and again has taken us by surprise, and we've seen again and again across Canada and around the world that where people socialize without physical distancing, where they socialize in close proximity, particularly outside their bubble with unfamiliar faces, this is how COVID spreads. What we will see in the coming days and weeks, we will let you know as we know it. What we will see in the coming days and weeks depends on each person following the Safe 6+1, getting vaccinated, and following the various COVID plans and rules and recommendations that exist.
Thank you. We'll move to Sarah, APTN.
Hi, can you guys hear me?
You're very faint, but yes.
Okay, try turning my phone up a little bit. Can you hear me a bit better now?
Yes, please go ahead, Sarah.
Okay, perfect. I guess I'm just wondering, with all these new cases, does this mean that we're going to be seeing more restrictions instituted again, or even perhaps closing the border again?
Mm-hmm. The question is, with all the new cases, will we see restrictions increase or go back to where they were previously? At this point, cases are linked to cases, events, or groups of people, and that's why this is an outbreak. We don't at this time have a plan. We have a plan for, we do have a plan for when and how we will increase measures if needed. We are not there yet, but we are examining this closely, and as the situation changes and as the information comes out, we may need to increase measures. It really does depend a lot on what happens in the next couple of days, and it also depends on everybody doing their part to be responsible at this time.
Thank you. Sarah, do you have a second question?
No, that's everything for me. Thank you so much.
Thank you very much. We'll move now to Luke, CKRW.
Hi, Dr. Elliott. I'm wondering how strong the messaging has been in schools towards youth as far as getting vaccinated goes. And I know a lot of the youth are finished school or getting out of school, whether that messaging is going to get stronger now that we're seeing this outbreak.
I think at this time, people are very motivated to get vaccinated. We've seen the numbers amongst youth and adults seeking vaccination increase, and this is what we want to see on an ongoing basis. We continue to encourage all youth between the ages of 12 and 17 to have their first shot, and if they've had their first shot, when the time is right, to have their second shot. We do see that happening. We will use communications to help people learn more about the vaccine. We have the website where people, young people and adults can book their appointments. We ask that you book your appointments online. Drop-in can be very challenging if a number of people show up at the same time. So we're really encouraging people strongly to book their appointments online and continue to do that. Thank you.
Do you have another question, Luke?
No, just the one for me. Thank you.
Thank you. We have had one question come in over the live stream, Dr. Elliott. So if I could ask you to explain to parents of graduating students or those who may have been involved in those events what they should actually be doing.
So parents of students who have graduated or who are being involved, who have been at graduating events, formal or informal, should be monitoring, the students should be monitoring themselves for symptoms. The parents who attended those events should be also self-monitoring, checking in with themselves throughout the day, seeing whether they have symptoms, isolating if they have symptoms, and seeking testing.
Thank you. I'd like to thank everyone for their time today. Our regular COVID-19 update will take place on Wednesday, June 16th at 10:30 a.m.